Welcome. Dr. Lael Yonker is a pediatric pulmonologist at Mass General Hospital for Children in Boston, Massachusetts, where she specializes in the treatment of lung diseases for children. In the early days of the COVID-19 pandemic, Dr. Yonker began admitting pediatric patients to the hospital with serious complications from COVID-19 weeks after their initial infections. The syndrome affected multiple organs and was named multi-inflammatory syndrome in children, or MIS-C. Dr. Yonker is a clinician researcher, and she became part of a national collaboration studying viral loads in children and the causes and possible prevention or treatment of MIS-C. In May 2021, the group published research showing large amounts of SARS-CoV-2 virus in the guts of children with MIS-C. The virus travels to the bloodstream, initiating the hyperinflammatory response seen in this condition. Dr. Yonker has successfully treated a small number of children with MIS-C by using a therapeutic currently in clinical trials for the treatment of celiac disease. Dr. Yonker joins us from Mass General Hospital for Children. Welcome, Dr. Yonker. We'd like to ask you some questions.
Sure. Thanks for inviting me.
You bet. So we've seen pediatric hospitalizations rise rapidly with the development of the Omicron variant. And parents are asking, how likely is it that my child will contract COVID-19, either the Omicron variant or another? And how likely is it that they will become severely ill or hospitalized?
Yeah, that's a very common question these days, as Omicron is highly contagious, and we're seeing a lot of COVID in the community. And so, the virus is supposed to be more mild than prior variants, but much more infectious. So more people are getting infected, and I think just proportionally, we're seeing a lot more hospitalizations. And that includes kids. So there's just a lot of kids that are going out there that are getting hospitalized. And the more kids that are the more kids that are infected, just that ratio, even if it's a small amount, a small percentage of kids, if there's a large denominator, there's going to end up being a lot of hospitalizations for kids. And that's for acute COVID. And so that's when kids have really the pulmonary symptoms from COVID. Mm-hmm. What we know and what we've seen over the past 2 years is that about a month after the peak of COVID, we start to see these kids come in with MIS-C, or as you mentioned, this multi-system or multi-organ inflammatory syndrome in children. And so what we see is the kids then, they don't have respiratory symptoms anymore. And they may not even have realized that they had COVID, weeks to months ago, but they come in with high fevers. And they do on blood tests show that they have antibodies against the virus. So we know that they were exposed. Mm-hmm. And then they have multi-organ injury and they require hospitalization, and they can become quite sick. Many of them need intensive care. And so this is something that we will see. We anticipate seeing numbers go up in the next upcoming weeks to months following this Omicron peak. But so it's definitely, keeping, the surge is something not just to be worried about today, but what's going to be coming down the line.
Right. So you expect numbers of MIS-C to increase as well.
Yeah. Yeah.
Okay. All right. That's yeah. Mm-hmm. Does MIS-C affect children of all ages in the same way, or is there a same what's the variance in the rate in children?
Yeah, the average age is really the 8, 9, 10 is that's where the average age of kids presenting with MIS-C. But we do see it from a young infant all the way up through the 20s, and actually there is an entity called MIS-A, so it's the same syndrome but in adults, and so it's less common in adults, but it is something that does exist. So it seems to be more focused on kids, especially the school-aged kids.
Mm-hmm. Okay. All right. Well, we'll come back to MIS-C, but we could focus on the general COVID-19 infection rate in children, and how important is it for children ages 5 and up to be vaccinated, and do they need to be boosted as well?
Actually, that's a really great question. It's incredibly important for all individuals who are eligible for the vaccine to be vaccinated. And we know, looking at national numbers, that the kids who are getting hospitalized mostly are kids who are not vaccinated, just like we saw earlier on with the adults, and we continue to see. We really need to get kids vaccinated. It helps prevent severe illness, it helps prevent hospitalization. Clearly, people are still getting the virus with Omicron, but the illness is much more mild if you're vaccinated. And we're now seeing, and the guidance is out, that after 6 months, kids should get boosted. And we have a study out, a preprint showing that even in adolescents, just like we've seen it in adults, the antibody responses wane considerably by 6 months. And so there, a lot of kids got the 12 to 15-year-old booster recommendation came out a little over 6 months ago. So all those kids are due for boosters, and they really need to get those. So kids should get vaccinated as soon as eligible, and they should get boosted after 6 months.
Okay, so parents listening, check on your children's vaccination and their booster requirements. Very good.
Yeah.
Now that's great for kids 5 to 12 or 5 to 18. What about the parents of preschool kids? What can you tell them about protecting their kids from infection?
Right. The kids under age 5 don't have a vaccine available to them yet, and studies are in process. So hopefully something will come along soon. But in the meantime, we have to do our best to protect them as a community. So that means parents, vaccinate yourself and your family members. Try to minimize risks by minimizing sort of social exposures. If the recommendation by the American Academy of Pediatrics is that kids ages 2 and older wear masks when they're out, in public places or in group settings. So, trying to, at this point, kids should be pretty familiar with wearing masks, but continuing to, increase their comfort in doing so. And that's really the best we can do, is try to protect them as a community.
Very good. Okay. So just to go back to Ms. C, I'd like to ask you a couple more questions about that. Are children with pre-existing conditions more susceptible to that? And in particular, is autoimmune? Does that affect their risk?
Interestingly, it seems as though pre-existing conditions and immune deficiencies really are more a risk factor for acute COVID, so that early infection. But Miss C doesn't seem to have any predisposing conditions. So it's, previously healthy kids often are the ones who end up getting Miss C. So there's no rhyme or reason that we know of yet. Perhaps there's some subtle genetic predispositions, but nothing that's obvious, nothing that's associated with other illnesses. But these are things that are being looked at. There are some kids. I should backtrack a little. There are publications showing that some kids with immune deficiencies are more susceptible to Miss C. But again, not commonly what we're seeing. More commonly, those kids are susceptible to acute COVID, and then most of the kids with Miss C are actually healthy.
Okay, so children with certain autoimmune are more susceptible to acute COVID.
Yeah.
Okay, and also if you could describe your research into Ms. C. I mean, you are a pediatric pulmonologist who's been studying asthma and cystic fibrosis primarily, and suddenly you were thrust into this new world of COVID-19, and then Ms. C came along, and the collaborations of your group have been fantastic in getting some really interesting and exciting research, taking us from the condition, a really terrifying piece of it, development of the condition, to possible prevention and treatment. So can you give us a little snapshot of that?
Sure, absolutely. Yep. So I'm a pediatric pulmonologist and still am the director of the Cystic Fibrosis Center here at Mass General. And inflammation and related to airway infection is so common in cystic fibrosis. And that's what my research had centered on before COVID. And I collected patient samples to try to better understand these responses. And so when COVID came along, it made sense that I just sort of pulled in a parallel research arm where I was looking at how the body responds to infection with COVID. And then that's sort of, we've been really learning more as we go. And I've had some really incredible collaborations and been able to build on a lot of what we've learned from adults with COVID, what we've learned from other illnesses. And so we've really come a remarkable way in a very short time. And so one of the things, you had sort of alluded to earlier was now I'm working with the Fasano lab, and they've really understood, they've really are world leaders in the understanding of zonulin and its role in the gut, and how leaky gut sort of develops. And that's a real problem in celiac disease. And so we've been able to work with them to better understand. And what we wrote in the article that was published in the Journal of Clinical Investigations back in May was that viral particles, the virus in the gut, sort of lingering virus after you have the acute COVID, this lingering virus irritates the gut and causes zonulin release. And that zonulin, as it's released, causes some leaky gut, and viral particles can leak into the blood. And knowing this, we've been able to build our understanding of the disease and even start to understand how potentially we can start to treat it.
That's very exciting. And we'll be watching you because you're developing clinical trials for the therapeutic, which is liraglutide acetate, and its use in MIS-C. So we'll be watching for that. My last question, Dr. Yonker, is, you're a parent with young children, so you've gone through this both as a doctor and also as a parent. And I was wondering what the experience of caring for these kids with MC has taught you, and also as a physician working on this cutting edge of pediatric COVID, has it affected how you approach your clinical or your research projects?
Absolutely. I would say, I've been very cautious with the virus and with the pandemic, and, trying to keep life as normal as possible, but safe. And because I'm trying my best to keep us protected from the virus. But I have to say that talking with a lot of the families who develop MIS-C, we in the medical community are very familiar with MIS-C, but families aren't as familiar with MIS-C. So I think it is important for pediatricians, especially to inform patients as they come in about just another reason why we're trying to not have kids infected. But a lot of the families that come in have never heard of this before. And they all say they don't want to go through this again. When can I get my kid vaccinated? Or, what can I do to spread the word? So, so people, the patients really don't want, they didn't know about it, and they want to help prevent this from happening again to their child or to any other child. And so, in that sense, as a parent, I've been a little more cautious because I'm highly aware of the full risks. And how has it affected my research? I think it's been, this has really become a large part of my research. It's really pretty amazing the impact that the research that we're doing is having on lots of other children and policies. And so we're really trying to learn as much as we can. We're still collecting samples from kids who come in with COVID or MIS-C or who are now getting the vaccine, because we want to learn as rapidly as possible and then share all of our information with the community as quickly as possible, because everything's moving fast. And so we want to try to keep everybody updated with what's happening in children specifically, because, they're also part of this pandemic. And so we just want to make sure that, that we're learning for the kids as well, and not forgetting about them, even though we know that the mortality and the severe disease really impacts the adults. But I think kids play an important role as well.
Yeah. Yeah. Well, thank you very much, Dr. Yonker, for pointing out it's really a web. We're all interconnected and affecting each other. It's not, you can't separate children from any of
Exactly.
the rest of us. Yeah. So
Exactly.
thank you very much. You've been very helpful in shedding some light on COVID and pediatric COVID and what parents
Thank
can
you.
do. And we will list some resources for parents at the end of this talk. And we'd like to thank you and all your wonderful national collaborators at Mass General and throughout the world, really, and helping us fighting this pandemic and keeping our kids safe. We look forward to talking with you again soon.
Thank you.
Very much. Thank you.